A 75-year-old client post-kyphoplasty desires discharge to home. The client's medical history includes thrombocytopenia and emphysema necessitating nighttime oxygen therapy. To ensure safe discharge, what should the nurse prioritize assessing? A. Home care resources. B. Pain management plan. C. Self-care deficits. D. Medication regimen. Answer: C. Self-care deficits. Assessment of self-care deficits determines if additional resources or education are necessary for safe discharge. While pain management and medication regimen are important, addressing self-care deficits is crucial for ensuring the client can manage at home. A client is admitted for coronary artery bypass surgery, CABG, with an expected stay in the coronary care unit, CCU. Which action is crucial in predicting care sequence, timing, and hospital stay course? A. Implementation of a clinical pathway. B. Initiation of a client's education plan. C. Implementation of physician-initiated interventions. D. Initiation of discharge planning at admission. Answer: A. Implementation of a clinical pathway. Clinical pathways outline treatment goals, expected course, and progress, guiding care throughout the hospital stay. They help predict and streamline care, ensuring consistency and efficiency. A 70-year-old client hospitalized for 5 days with deep vein thrombosis and a history of a brain tumor has an imbalanced nutrition nursing diagnosis. Which finding suggests a need to revise the care plan? A. Dry oral mucous membranes due to dehydration. B. Inadequate daily caloric intake. C. Client's resistance to nutrition education. D. Client's lack of hunger. Answer: A. Oral mucous membranes are dry due to dehydration. Dry oral mucous membranes indicate dehydration, which can affect the client's ability to consume adequate nutrition. Revising the care plan to address dehydration is essential for improving nutritional status. A pediatric client diagnosed with cystic fibrosis is discharged home. A multidisciplinary care conference is held to address family concerns. Which disciplines should participate? A. Nurse. B. Pharmacist. C. Dietitian. D. Social worker. E. Nursing assistant. F. Respiratory therapist. Answer: A, B, C, D, and F. Comprehensive care planning requires input from multiple disciplines to address medical, nutritional, social, and therapeutic needs. Collaboration ensures holistic support for the client and family. Hey future nurses, are you looking for an online NCLEX course? You're in the right place. Embark on your journey to NCLEX success with our all-inclusive online course, offering a comprehensive blend of animated crash courses, recorded video lectures, a question bank containing over 3,000 practice questions, NGN questions, mock exams for a realistic test experience, audiobooks, ebooks, and a bullet points book. Everything you need to ace the exam, all in one place. Here's a sneak peek into what our course offers. Animated crash course. Engaging animations cover all key topics tested in the NCLEX exam. With over 100 questions derived directly from our crash course, you'll be prepared for anything the exam throws at you. Recorded video lectures. Learn from the best NCLEX trainers in the world. Our recorded lectures provide in-depth explanations and strategies to tackle even the toughest questions. Question bank. Practice makes perfect. Access over 3,000 NCLEX practice questions carefully selected based on the most frequently tested topics over the past 5 years. NGN questions. Gain access to next-generation NCLEX-style questions to familiarize yourself with the latest exam formats and requirements. Mock exams. Experience the real exam environment with our mock tests designed to simulate the NCLEX exam to perfection. Audiobook and ebook. Study on the go with our audiobook and ebook versions covering all essential nursing topics for your convenience. Bullet Points Book. Need a quick review? Our Bullet Points book condenses key information into easy-to-digest format for fast revision. Don't miss out on this opportunity to accelerate your journey towards becoming a licensed nurse. Enroll now and enjoy a 70% discount exclusively for early birds. Act fast, as this offer is valid only for this month. After that, prices will rise. Don't let this chance slip away. Invest in your future. A nurse reviews the care plan for an elderly client with COPD and limited mobility, noting a planned increase in ambulation distance. What action ensures the client's needs are met? A. Instructing the physical therapist to wait for the nurse. B. Informing the therapist of the client's respiratory status. C. Canceling the physical therapy referral. D. Informing the physician of the therapy plan. Answer: B. Informing the physical therapist of the client's respiratory status prior to progressing ambulation. Communicating the client's respiratory status to the physical therapist ensures safe progression of ambulation, considering respiratory limitations. Collaboration between nursing and therapy optimizes client care. A client with chronic renal failure dislikes all foods on the restricted renal diet. What collaborative action best addresses the client's needs? A. Reviewing and compromising on acceptable foods. B. Reviewing the list with the primary meal preparer. C. Reporting non-compliance to the physician. D. Contacting the dietitian for counseling. Answer: D. Contacting the dietitian to counsel the client on acceptable foods. Dietitians specialize in nutrition therapy and can provide tailored guidance to address dietary restrictions while meeting the client's preferences and nutritional needs. A client's pulse oximeter frequently alarms, showing fluctuating readings. What action helps establish a safe and accurate reading? A. Replacing the oximeter. B. Consulting with an experienced nurse. C. Turning off the alarm. D. Notifying the physician. Answer: B. Consulting with a more experienced nurse to determine. Seeking guidance from an experienced nurse can help troubleshoot equipment issues and ensure accurate readings, promoting safe patient care. A client with delirium tremens needs sedation. Unsure which medication to administer, what should the nurse do? A. Administering the same medication as before. B. Contacting the physician for different orders.
Coaching.
C. Administering propofol immediately. D. Consulting with the pharmacist. Answer is D. Consulting with the pharmacist on the medications previously given and the actions of the prescribed medications, requesting a recommendation for which medication to administer. Pharmacists are medication experts and can provide guidance on appropriate sedative choices based on the client's condition and previous responses, ensuring safe and effective care. A post-operative client shows signs of respiratory distress. What immediate steps should the nurse take? A. Prepare necessary equipment. B. Contact the surgeon. C. Request the rapid response team. D. Assist in the reassessment. E. Communicate using SBAR. F. Be present to answer questions. G. Contact the client's family. Answer: D. E. A. B. C. F. Then G. Reassessing the client, communicating effectively, preparing equipment, and escalating care through the rapid response team and surgeon ensures prompt intervention and optimal patient outcomes. A new client requires an initial admission assessment. What should it include? A. Collection of subjective data. B. Vital signs. C. Development of the care plan. D. Functional ability assessment. E. Documentation of education completed. Answer: A, B, and D. An admission assessment should gather subjective data, assess vital signs, and evaluate the client's functional abilities to inform care planning and ensure holistic patient assessment. Development of the care plan and documentation of education occur following the assessment. The nurse is knowledgeable about the nurse-sensitive quality indicators related to the management and prevention of hospital-acquired infections as outlined by the American Nurses Association. What nursing action is most effective in reducing hospital-acquired infection rates? A. Maintaining optimal nurse-to-client ratios. B. Enhancing team performance. C. Keeping a close eye on medication safety events. D. Making sure there are enough supplies for care delivery. Here's the answer. A. Maintaining optimal nurse-to-client ratios. The American Nurses Association emphasizes the crucial importance of having the right numbers and mix of nursing personnel, registered nurses, licensed practical nurses, and unlicensed staff in order to ensure the provision of safe, cost-effective quality care. This also encompasses the decrease in hospital-acquired infections. While it is crucial to prioritize quality client care, team functioning, medication safety events, and adequate supplies, it has not been shown that these factors directly affect infection rates. Although nurse-to-client ratios are crucial for positive patient outcomes, it is important to also emphasize the significance of team functioning, hand hygiene, and appropriateness of supplies. A nurse is providing hospice care to a client diagnosed with cancer. The client is in the final stages of life and is currently enduring intense pain. The client emphasizes the importance of being present and available for quality time with family members. Which approach will effectively tackle this issue? A. Consistent care. B. Educating the client. C. Evaluating therapeutic decisions. D. Re-evaluation. The answer is C. Evaluating therapeutic decisions. The nurse can use therapeutic judgment to administer smaller doses of morphine, ensuring the client's comfort while also allowing them to remain alert and present with their family members. The practice of standardized care involves administering a typical morphine dose as a standard approach to pain management. However, this usual dose may result in drowsiness. Client education alone does not fully address the important aspects of pain management or the need for companionship with family. The process of reassessment involves determining whether a problem still exists. A client diagnosed with hyperglycemia is currently receiving a continuous intravenous IV insulin drip. Regular blood glucose measurements are being conducted every 1 to 2 hours. The client's blood glucose is checked by a nurse, and the reading is 29 mg per dl. The client, who was previously alert, appears to be experiencing lethargy and is unresponsive to questions. The nurse follows the protocol and administers 25 ml of D50W. The client provides their response. What other risk management action should the nurse take? A. Continue the insulin drip. B. Notify the nurse manager about the event. C. Please recheck the blood glucose measurement in 1 hour. D. Administer an additional dose of 25 ml of D50W. The answer is B. Notify the nurse manager about the event. It is important to report safety events to the nurse manager. Risk management aims to identify and eliminate potential safety hazards. The monitoring and medication protocol may require adjustment based on changes in the client's condition and corresponding blood glucose results. The nurse manager should be informed about the client's hypoglycemia so that patterns and trends can be monitored and, if necessary, regulatory reporting can be done. Certain states have regulations in place that mandate the reporting of cases where hypoglycemia results in harm or fatality to the client. Continuing the insulin drip would lead to harm for the client. 1 hour is an excessive amount of time to wait in order to determine if the client is still experiencing hypoglycemia. Before administering a second dose of D50W, it is important to evaluate the client's response and check their blood glucose levels again. Before administering medication, the hospital policy mandates a thorough verification of 2 distinct client identifiers against the Medical Administration Record, MAR. A nurse manager assembles a performance improvement team with the aim of enhancing nursing compliance with a crucial safety check. Which activity should the performance improvement team be responsible for when it comes to checking two unique identifiers? A. Ensure that staff are held accountable for consistently checking two unique identifiers. B. Ensure that staff members are held accountable for not following the protocol of checking two unique identifiers. C. Observe and report the practice of medication administration. D. Modify the practice of using two unique identifiers to align with compliance standards. The answer is C. Observe and report the practice of medication administration. It is crucial for individual clinical units to proactively and autonomously monitor their compliance with client safety initiatives. The role of a performance improvement team is to carefully observe and accurately report measures within the initiative. The nurse manager is responsible for ensuring that staff members are held accountable for their practice and, if necessary, taking disciplinary action. The main focus of performance improvement is on education and system changes to ensure client safety, fostering an environment where blame is not assigned. The practice of checking two unique identifiers is crucial for ensuring client safety. Therefore, it would be unsafe to make any changes to this evidence-based practice. During a staff meeting, the nurse manager informs everyone that the unit is currently exceeding the budget by 3% and emphasizes the need to cut costs. The staff nurse proposes a more concise report to allow nurses to complete their shifts on schedule. What metrics should the nurse manager use to evaluate the effectiveness of this idea? A. Pay close attention to the change of shift report to assess the number of nurses who are able to leave on time at the end of their shift. B. Assign the responsibility of end-of-shift monitoring to the charge nurses. C. Make sure to review the capital budget every month. D. Keep an eye out for any decrease in the number of hours per client day. Correct answer is D. Keep an eye out for any decrease in the number of hours per client day. The nurse manager can use monitoring hours per client day to assess if staff members are completing their shifts closer to the end, thus potentially reducing clinical hours. It is possible that a decrease in client hours per day could suggest that shortening the end-of-shift report is having a positive impact. Merely relying on the shift report or leaving the monitoring solely to the charge nurses won't accurately gauge the level of success. Only equipment with a minimum dollar cost is included in the capital budget, with no consideration for labor costs. Before we move on to the next question, we have urgent news for you. We've meticulously crafted a 100-hour animated NCLEX review crash course, and for this month only. In the initial 30 hours, we comprehensively cover all the crucial NCLEX topics with engaging animations, but that is just the beginning. The remaining 70 hours are dedicated to dissecting 5,000 NCLEX questions through dynamic animations. Along with animated lectures, you will also get NGN questions, an ebook, practice test series, and many more resources. Imagine learning with interactive visuals instead of being buried in a mound of tedious text. Say farewell to monotonous study sessions and welcome a revolutionary animated learning experience. This 100-hour course is your passport to mastering the NCLEX exam with unwavering confidence. Remember, animation significantly enhances information retention. Don't miss out on this limited time offer. We're offering an astounding 70% off for this month only. Click the link below, enroll today, and embark on a journey where animated education leads to exam triumph. Your success story begins now with our 100-hour animated NCLEX course at an incredible 70% off. Enroll immediately and wave goodbye to dreary textbooks. Now, let's swiftly move on to the next question. A nurse comes across a notice on a bulletin board about a continuing education CE opportunity focused on preventing pressure ulcers. What is the most convincing reason for the nurse to attend? A. There has been a rise in pressure ulcers within the unit. B. The nurse is seeking further education to stay updated on current clinical knowledge. C. The nurse requires an additional CE unit to renew their state license. D. The nurse can accommodate by arriving 1 hour earlier than the next scheduled shift. The answer is B. The nurse is seeking further education to stay updated on current clinical knowledge. In order to stay up to date with evidence-based practice, nurses must engage in continuous education even after completing their nursing program. The field of evidence-based practice, EBP, is constantly evolving, with the latest advancements in healthcare significantly impacting nursing practice. All the other options have their merits, but the most convincing reason to attend is for professional growth. The role of a nurse educator involves instructing staff members on how to prevent central line-associated bloodstream infections. A new procedure has been implemented to ensure the prevention of infection during central line dressing changes. Please inform the staff about the change in procedure. Which method of education would be most effective in improving the staff's ability to retain this information? A. Continuing education. B. Certification. C. Non-formal education. D. Contact hour. Here's the answer. A. Continuing education. Training sessions are available at the workplace and are designed to cover topics such as new equipment or policies. Certification serves as a formal validation of extensive knowledge in a specific area of practice, usually conducted by a nursing certifying organization. Informal education involves individuals sharing knowledge with each other to expand their existing understanding. Continuing education credit is measured by contact hours. After a same-day surgical procedure, a client and their family are getting ready to go home. During shift change, a nurse walks into the room and the family expresses their dissatisfaction with the previous nurse. The user expresses their relief that another nurse has taken over and mentions that they found the discharge instructions confusing and incorrect. The family expresses uncertainty regarding their knowledge of dressing changes and appropriate activity levels for the client. To prevent this situation from happening again, what action should the oncoming nurse take after meeting the needs of the client and the family? A. Inquire with other nursing staff about any similar situations they may have experienced while working with the nurse mentioned by the family. B. Review the discharge documentation to assess whether the previous nurse has provided the necessary education. C. Notify the risk manager about the client and the family complaint. D. Inform the nurse manager about the incident involving the previous nurse's incompetence. The answer is D. Inform the nurse manager about the incident involving the previous nurse's incompetence. Failure to report another healthcare provider's incompetence or negligence is a frequent cause of malpractice lawsuits. Supervision involves the crucial task of ensuring the safety and thoroughness of care. The oncoming nurse has a responsibility to report any incomplete care for a client to the nurse manager within the context of supervision. The responsibility of collecting data regarding the nurse cited by the family and evaluating competence lies with the nurse manager, not the oncoming nurse. The client complaint does not need to be escalated to the risk manager as the nurse involved has the chance to address the issue. The nurse manager is assessing the time management skills of a new nurse. Which statement made by the new nurse suggests possible issues with time management? A. I apologize for the delay in administering the antibiotic as I had to assist with a dressing change. B. I completed the physical assessment before checking for morning medications to be given. C. I wasn't able to leave on time because I helped a client who arrived 15 minutes before my shift ended. D. I would like to leave, but I still need to document all the medications I administered today. The answer is D. I would like to leave, but I still need to document all the medications I administered today. Effective time management skills can help alleviate stress for nurses. Documentation should be completed promptly, particularly for medication administration. In the ever-evolving landscape of client care, certain aspects of care may experience delays, or nurses may not be able to complete their assigned shift on time due to external factors. Time management skills are important for nurses, despite this misconception. The nurse is providing care for a patient who underwent colorectal surgery on their first day after the operation. The nurse is prepared to administer an antibiotic. However, it's not listed on the Medication Administration Record, MAR. Upon reviewing the physician orders, it was noted that an antibiotic was prescribed but has not been administered since the surgery. According to the order, the client has failed to take 3 doses. What action can the nurse take to reduce the risk of malpractice? A. Reach out to the previous nurse to investigate the source of the omission. B. Submit an incident report. C. Please contact the physician and kindly request a new antibiotic order. D. Ensure that the reason for the error is promptly documented in the medical record. The answer is B. Submit an incident report. An incident report, also known as an occurrence or variance report, is a formal documentation of an unexpected event or accident. Submitting an incident report is crucial for documenting the error and reducing the nurse's risk of malpractice. It is important to thoroughly investigate the source of the error for agency follow-up. This should involve reaching out to previous care nurses to ensure that similar mistakes can be avoided in the future. It is important to reach out to the physician, although it may not necessarily reduce the risk of malpractice by simply asking for a different antibiotic. This report is intended for the agency and is not included in the client's records. Unfortunately, there was an error in processing the admission order for a client to be on a venous thromboembolic protocol. After 2 days, a nurse discovers that the order for heparin 5,000 units subcutaneous every 8 hours was overlooked. What is the most suitable way to follow up? A. I'm relieved that I avoided that error. The other nurse may face consequences for their actions. B. I don't have enough time to finish a variance report. I'll get it done next week. C. I need to get in touch with the doctor and finish up a variance report. D. I will reach out to the supervisor right away regarding this mistake. The answer is C. I need to get in touch with the doctor and finish up a variance report. Nurses play a crucial role in the recognition and reporting of errors within reporting systems. There has been a recent focus on promoting blame-free error reporting and exploring ways to utilize the system to minimize errors. It is important to complete variance reports promptly to ensure proper follow-up. The nurse should prioritize notifying the physician and documenting the event in a variance report. While it may also be appropriate to contact the supervisor, the primary responsibility lies with the nurse. The client is admitted with a positive culture for methicillin-resistant Staphylococcus aureus, MRSA. Implementing contact precautions is crucial in preventing the spread of infection to healthcare workers and other clients. What are the components of contact precautions? A. It's important to wear a mask when working within 3 feet of the client. B. Providing the client with a private room. C. Wearing an N95 respirator is essential. D. Utilizing a negative air pressure room for the client's placement. The answer is B. Providing the client with a private room. It is recommended to isolate the client in a private room or with another client who has the same organism causing an active infection and no other infections. For contact precautions, there is no need to use a mask, N95 respirator, or negative air pressure room. These measures are specifically included in airborne precautions. A client has a scheduled hysterectomy tomorrow morning. The client will be admitted from home on the same day as the surgical procedure. It is crucial for clients to receive which specific instructions before arriving at the hospital in order to prevent post-operative infection, as stated by Medicare's Surgical Care Improvement Project. A. Make sure to arrive on time to receive an antibiotic before your surgery. B. Please inform the nurse if you have any allergies to antibiotics. C. Please remember to wash your hands before arriving at the hospital. D. It is important to avoid shaving hair from the surgical site area. The answer is D. It is important to avoid shaving hair from the surgical site area. The use of a razor to shave the surgical site can result in small skin lacerations, which may increase the risk of infection. The act of shaving can disrupt the hair follicles, which are commonly inhabited by Staphylococcus aureus bacteria. Shaving the night before surgery poses the highest risk of infection. It is recommended to have your hair clipped on the day of surgery. It's important to inform clients about the potential risks of shaving a surgical site before they come to the hospital. The timely administration of antibiotics is crucial for clients, and fortunately, the preoperative preparations make it easy to meet the 1-hour time frame. It is crucial for the team to be informed about antibiotic allergies, although this alone will not prevent infection. Similarly, while it is recommended for clients to wash their hands before arriving at the hospital, it does not guarantee prevention of infection.